So in today's session, there's a couple of objectives that I would like us to achieve. And that is to, number one, understand the core approaches to qualitative data analysis and discussions on how policy and practice. So remember, qualitative analysis is not just about describing what participants said. It's about interpreting meaning and situating it within a specific context. So from our previous session, we learned that qualitative research is like storytelling, and this enables us to capture lived experiences. So while this storytelling allows us to do so, we must always remember that, for us to conduct qualitative research, we are focusing on understanding, specific behaviors and social phenomena. And this process is made possible by collecting and analyzing non-numerical data. These type of data could be words, images, or observations. So unlike quantitative research that seeks to quantify data and test a specific hypothesis, qualitative research aims to explore the how and the why behind people's thoughts, feelings, and actions, and therefore leading to capturing more depth, meaning, and context in much more richer detail. And this is very important for us if we want to understand why certain things are occurring or happening in much more detail. So there are various processes or various ways of knowing, the sampling for your qualitative research that we've touched on as well. And this is just a recap. And I've mentioned that, choosing your participants mainly depends on your design. And for example, I mentioned that, if you want to conduct a study that is focusing on a specific phenomenon, the sampling criteria that you're going to use will be to have participants who meet that specific criteria of having experience on that phenomenon. For example, if you want to interview participants who experienced or who lived with COVID-19, for you to be able to capture how that phenomena occurred, you would want to have those specific individuals for you to get that rich insight that you're looking for. So I won't waste much time in talking about this because it's more of a recap. So here I have a table that actually shares how each specific research design, qualitative design, would require a specific sample and the kind of data you'll be able to collect while using that specific design. And I want us to start talking about the process of qualitative data analysis. And this is a very important part of your study, because this is now where you get to make meaning of the data that you've collected. So with literature, the many literature that's available, you would see that qualitative data analysis follows a specific systematic process. And this process starts initially with the data collection, moving on to familiarizing yourself with the data. Then after, the aspect of coding comes in. From coding, that's where now you start moving into your theme development. And after the theme development, you move into the interpretation of what those themes mean, and then later on finalizing with the reporting process. So I know that as I'm saying now, this sounds like it's a very simple, straightforward process, but I'm going to break it down for you so that you understand why each and every step is quite critical and important, and why it's important for you to make sure that you understand this systematic approach to data analysis. So I will start off by grounded theory. And here I mainly say that I'm covering the basics. So this is what you would need to know for you to be able to analyze qualitative data with with a mindset of developing a theory. Remember, we've mentioned that in the previous session that grounded theory is a methodology that develops theory directly from the data rather than testing a pre-existing one. So this process of grounded theory is inductive. By inductive, it means that the analysis is guided by what the data is and what you are finding within the data. So here, this inductive process is guided by the constant comparison, memo writing, and theoretical sampling, which involves collecting your data until saturation is reached. So remember, we talked about saturation, and saturation is when you collect your data until to the point where there is nothing new or no new insights coming out. And that's where we'll say that you have achieved the concept of saturation. So this type of analysis is very useful for exploring social phenomena that are not yet well understood. For example, I will use COVID-19 as an example that is much more relatable to many of us, that there were symptoms and many other issues that came with COVID-19 that were not well understood, which made the public health system not fully prepared to actually address it timeously. So this kind of data analysis is very useful into exploring such kind of phenomena. Now, I want us to talk exactly at how grounded theory works, and particularly grounded theory data analysis. And to start off, I will talk about the coding of the data. And the grounded theory follows a three-step approach, and this is organized in this fashion. And the first one would be open coding, which is the part where, or the phase where you identify key ideas. And the second part is the actual coding, where you now connect the codes. And then the third being selective coding, where you refine these codes into themes. I'm going to break down all these three steps for you so that you can understand what exactly happens in each one of them, and for you to be able to know exactly how you should be doing them. So I'll start off with open coding. And open coding, which I mentioned that this is a part where you identify key ideas, is done so that you can be able to ground theory into your data, and you are able to handle the complexity of your data. Remember, when we talk of qualitative data, we're talking about volumes and volumes of data. And this data is textual, meaning that you have to do a whole lot of reading for you to be able to understand. So this open coding allows you to handle such volumes of data. And this is where you will now be able to build towards a broader analysis. So there are various steps that are involved for you to do this open coding. So open coding involves these steps. Number one, which is preparing and immersing yourself into the data. So this part would require you to be reading your transcripts. So transcripts are what you're going to get after you have now done your interviews, you have recorded, and you have transcribed them verbatim, and they are now in textual data or documents. So you now take time to read all those documents and familiarize with yourself with the data. That's what we call data immersion. And from there, you now start by fragmenting, you follow by fragmenting the data. So fragmenting the data, this is now breaking it into different pieces. And this is like, if you have a puzzle piece and you are taking it apart so that you can see which piece fits to the other. And then once you have fragmented your data, this is now followed by labeling your data to actual codes. And you do this on a line-by-line basis. And from there, you compare and iterate. So you will now start looking at your different codes, that which one, are closely related, which one are actually showing the same thing, and which one can actually be grouped with one another. And the final step will be documenting and reflecting. So you would need to now say, okay, so now you've got all these different codes. What do they mean? And you do this by writing down their meaning and what they are showing you as a researcher. So it's very important that you avoid some of the most common mistakes that researchers usually make, which is overcoding. And a good example of this is avoiding having multiple overlapping codes, per sentence, because this would lead you, to having not so good quality reporting of your data. So I'm going to move on to an example just to explain exactly what I meant with the previous slide. And I have an excerpt that I want us to look at, which will help you understand the different steps that I've mentioned now. So our excerpt says that patients often clam up when I ask about their habits, like they are scared I'll judge them. Last week, one guy said, "Doctor, it's hard to admit I'm not perfect," and shut down. So if we are to apply those different stages that I've just mentioned about into open coding, we will need to now start by fragmenting our data. So remember, I said the first part is immersing yourself. So you've read your transcript, and now you need to break it into different parts. And this is how we're going to break this excerpt. Number one, patients often clam up. And number two, it's likely they are scared I'll judge them. Number three, last week, one guy just said it's hard to admit I'm not perfect. And then number four, and shut down. So here you are able to now start coming up with your initial codes. Remember, I said that codes are labels of different meanings that you are thinking your data is saying. And this is now the part where you start applying your analytical mindset. So it's very important that you are not just reading these different excerpts, but you also read with an analytical mindset. And this is how your initial codes will look like. Number one, being that patient withdrawal during sensitive topics. And number two, perceived judgment as a barrier. Number three, in vivo, not perfect, self-stigma. And number four, conservational shutdown. And from there, then now you start moving into the iteration phase. And this is now where you start to compare across your transcripts so that you can look at those codes that are showing similarities. And this will actually lead you into having or highlighting what the key idea is arising or emerging from those codes that you have identified. Right, and then we now move into the second part, which is the axial coding. And this is the part where now you start to connect these codes into, what do they mean? And it's very important that when you do this part, you ask a couple of questions that would actually assist you into knowing that you are actually connecting these codes correctly. And the kind of questions that you would need to ask, for example, if you are looking at various components such as a phenomenon, you will need to ask yourself, what is the central idea from the data? And from our previous example, we will see that patient silence during sensitive discussions. So this tells you that, patients are not necessarily comfortable talking about, sensitive issues. And this is a very important question to ask, because when you look at the data, you then get, okay, this is the phenomenon that's taking place. And the second phenomenon or second component will be the causal conditions. So what led to these phenomenon occurring? And that is from our previous excerpt, is that there was a fear of judgment. And this could be due to past experiences that this patient experienced. And also we factor in the component of context. And this would lead you to asking a question as to where and when does it occur? And from our previous excerpt, we learned that during lifestyle habit inquiries, and in rushed appointments, this is where you'd see that this context leads to this patient feeling that, they are being judged based on their previous experiences, like they were saying to the doctor. And then we now look at the type of interventions or intervention conditions. And the kind of question that you need to ask yourself is, what sort of influence or what influences the strategies? And looking from our previous excerpt is that, the doctor's tone, sort of like, gave a sort of assurance to, to the patient, and that sort of like enabled a trust level. It's very important when we dealing with patients to have a trust level that will enable patients to actually communicate truthfully about their conditions. And issues of time constraints would actually tell you that, this type of patient is in a rush to, they don't want to waste their time in this sort of issue that they want to actually talk about, or they want to actually share to their doctor, or explain to their doctor. And this type of intervention conditions would actually tell you how this actually influences the type of strategy the doctor will need to use in order to treat or help this patient. And therefore, we move into the type of action that would have to be, or interaction strategies. So how do other people around this patient, interact or respond to the situation or the phenomenon? And this is where you get to see that, in our previous excerpt, because the patient experienced, previous stigma or previous bad experiences, they now started to deflect, meaning that they changed the topic, showing disinterest into communicating or talking about what was the main issue, and therefore leading to a shutdown, which is the last part that we saw from our excerpt. And the last question then that you will ask yourself is that, what happens as a result? And this is where you would see that now you will have an incomplete medical history, and this would lead to missed interventions, because if you do not have a completed medical history, you won't have an understanding of what exactly led your patient to this kind of phenomena or challenge that they're experiencing. And therefore, there will be no intervention or suitable intervention to assist them address the challenge that they're experiencing. So these are the different levels of understanding how the various codes could be connected. And this part is what we actually refer to when we talk about axial coding. So you start making meaning of the codes by asking the relevant questions that will help you or assist you into breaking down all these different codes, so that they can start to make that meaning that you would like to actually answer specific questions. And then the Example that I would like us to look at into understanding, various, codes from actual coding, that is moving from the open codes to actual structure. And these would allow us to now start understanding, okay, so now we have had our labeling, and once we have now labeled our codes, we now need to start, connecting all these codes together so that we can start generating meaning. And this enables us to now move into the next part, which is now looking at how the themes come out. And the themes are what we are going to be interpreting, because this is the part where we are going to have meaning from the data. And there's a step-by-step approach to doing this so that we can be able to now understand how exactly do we refine all these codes into specific themes. And the first one would be to identify the selective or identify the category. And this is done by picking up the central phenomenon that everyone or that everything revolves around. And this could be, something that is much more frequent, or you see that it's occurring, multiple times, or there's, a number of people that have talked about it. And this is where now you start moving into having core categories. For example, you will have, a meaningful category that would be, titled protective silence. So here you're trying to add more meaning into what you had. So the patient had a breakdown. The patient didn't want to discuss further what they were experiencing. And from that, we saw that there was an incomplete medical history, meaning that this patient was not able to actually receive the sort of help that they were supposed to. And because this patient chose to not share or decided to avoid talking about their experiences, this had led to the doctor not in a position to understand fully what their problem is. And this is the kind of categorization that I would like you to understand. And this type of category, you then now apply your analytical mindset, and which you will name, protective silence, because this patient feels that if they are silent about what they're experiencing, therefore they will feel much more protected. That's exactly how you start looking at it. And then in the second part, or the second step, would be, to relate all the categories to the core. And this is done by systematically linking every actual category back to the core using words such as because and leads to, and in the context of, and many other. And this is where you get to link up various codes so that they can start making meaning. For example, we noted that our patient had a fear of judgment, and that fear of judgment is what triggered this protective silence that we are talking about. And then the issue of time, also amplified this protective silence, because they were in such a rush. They didn't want to, have that conversation with the doctor to share exactly what is wrong or what went wrong with them. And obviously, the issue of changing the topic, deflecting, is also another form of, protective silence. So you can see now all these different codes that we have stemming from that very same excerpt are now, telling us that there is a common theme that we can look into that will help us understand exactly, what the patient was experiencing or undergoing. So the third step now into this type of coding, which we are saying that this is now the refinement of themes, would be now that you've had the meaning, you've linked all these different codes, now you need to start having your your storyline. You now need to start writing your story. And this is where now you start drafting, the narrative that will tell us exactly what does this mean, for you as a researcher. Now you are, interpreting these data. So, and your draft line would read something like this. Protective silence emerges when patients perceive vulnerability in disclosing sensitive habits. And this is triggered by a fear of judgment and past negative experiences, and intensified in time-constrained, low-trust consultations. And patients strategically withdraw or deflect to safeguard self-image, and this leads to incomplete medical histories and missed opportunities for care. So you will see that from our excerpt, we have now added meaning to, what was shared to us from, this conversation between the doctor and the patient. And from that, we are able to have a relatable story that would tell us that, because the patient was not vocal enough to share exactly, what was happening or going on with them, this had led to them not receiving the kind of care that they would have gotten should they have disclosed the issues that they were dealing with. And this is how you start applying all these 3 steps so that you can start making meaning of the data and interpreting it, so that this would now lead to what we call developing a theory around what actually led to this patient not receiving the care that they deserved. And moving on, we now start talking about the 4th step. And this is, how do you move into selective coding? And this would involve you filling gaps with selective sampling. And you do this by revisiting your data, so that you can refine even more. Remember, we talked about the issue of data saturation. So you do not stop until you have uncovered all sorts of new meanings from your data. And this would mean that in some instances, you would have to, interview patients directly to understand exactly why, they stay silent. What is that root cause that's causing them not to actually be vocal about their experiences? And, what is actually contributing to them having that shutdown, and not say exactly what is leading to them not wanting to disclose. And this is that process that will now lead you into step number 5, where you get to now develop your theory. And this is where you get to refine your theory into a grounded theory statement. And this is where you can also get to, have a diagram that explains your theory, or a model. And for those who are familiar with this process, you would actually have something like a conceptual diagram that will help you explain this theory that you're having. So from our excerpt and the analysis while conducting the various stages of open coding, actual coding, and now selective coding, we can now say that the theory behind the data that we have is that protective silence is a self-preservation strategy in high-stakes medical disclosure. And this is shaped by emotional, relational, and structural conditions. So you see, from all that data that we got from the patient and the doctor, we have now came up with a new theory that would lead us into understanding exactly why patients do not want to disclose specific issues to their doctors. I hope that is clear. But if anything is not so clear in this part, please feel free to put questions in the chat, and then we will get to a chance to talk about them later. Great. So that is all I can say now about the grounded theory basics. And now I'm going to start moving on to one of the most commonly used type of qualitative data analysis, and you'd be, very intrigued about how useful this type of analysis is actually applicable to multiple qualitative research designs, and how it can actually enable your analysis to be very easy to do. And this is thematic analysis. So thematic analysis is a flexible, accessible method for identifying, analyzing, and reporting patterns. And these are themes within a data. So this type of analysis prioritizes, the descriptive and interpretative depth without necessarily requiring a specific commitment to an emergent theory development. So unlike grounded theory that we've just talked about, which focuses on us having a theory of what's actually leading to specific issues or specific phenomena, thematic analysis is much more focused on describing, the issues, like what is happening. And this type of analysis has been popularized by Brown and Clark. The 2006 paper actually explains, this type of analysis in depth, and it would be advisable for you to actually read it so that you can be able to understand, this in much more details. As today, we might not be able to cover everything, but will provide you with enough basics for you to have a solid grounding so that when you do further reading, you'll be able to understand it. So, according to Brown and Clark, they mentioned that thematic analysis should be the first type of qualitative data analysis that any qualitative researcher must, learn and understand how to do it. And, simply because, this type of, analysis or method is a foundational method, and it's usable across different paradigms. This would include when you are reporting participants' experiences, examining meanings within specific context, as well as when you want to blend both these issues. And exactly, there are specific steps that you need to know in order for you to conduct what we call a thorough thematic analysis. And according to Brown and Clark, they mentioned these phases to be very key for one to be able to analyze the data with rigor. And the first step, or the first phase to doing this kind of analysis, is obviously familiarizing yourself with the data. And like in grounded theory, as I've mentioned before, this is the part where you get to read your transcripts. You get to immerse yourself in the data, and understand what the data set is saying. This is where you'll get to gain intimate knowledge. And this is enabled by you transcribing your transcripts to verbatim. So usually we say that transcribing to verbatim is taking what the participants say as it is. You do not make any changes, because each and every sentence matters into giving clarity or understanding in depth of what exactly the participant meant. Because you have to understand that there are various ways of interpreting meaning within data. So once you start changing these transcripts, and they are not taken in verbatim, it could actually lead to a whole new meaning from the data, and not necessarily what the participant was saying. So like I mentioned, here you get to read and reread your transcripts multiple times, and you now start noting initial ideas. And this is where you get you start writing notes, thinking what exactly was meant here. This is the part where, if you were conducting the interviews, whether it's focus groups or in-depth interviews, you start also thinking about how the participants was showing different emotions when you were asking these questions, how they reacted, the body language. And this is the part where you don't necessarily start the coding process. So you have to avoid, the coding process at this point. And this is where you just get to focus on what exactly is going on. And that will actually assist you into having a better understanding of what the data is saying, or you become much more knowledgeable about the data that you have. And then the second phase is now the phase of generating initial codes. So like the phase says, initial codes. So this is a systematic process where you get to code interesting features, across the entire data set. Remember, if, for example, if you're having in-depth interviews, of over 10 participants, or whether it's focus groups, of over 6 to 8 groups sessions, you will now have to read each and every, transcript from each, data collection session. And with each and every one of those transcripts, you will now start coding the interesting features, for all of those transcripts. So this is also, quite similar to open coding, like we've mentioned in grounded theory. Here you get to label, your data accepts, collaterally. For example, you get to, label, codes such as, power imbalance in decision making. You can get to utilize various software, although in today's topic we'll only cover how you can actually do it even when you are using manual, because I know with software there's always a challenge of, okay, is this the right way of using it? But what I like about qualitative data is that you actually start the coding process, manually, because you first have to read, and then from there you will already start having an idea of what your data is saying. So this coding in some instances, for example, if you're using a software, you would now, label it and assign different colors into showing how the different codes are, being labeled. So the coloring would actually assist you into, seeing, what is now, that systematic process of showing what is similar, what is different, across the different transcripts. Remember, you've got volumes of data. So it's very important that you make this process quite simple for you so that you can see, across the different data sets, what were those, interesting features, although you will see that with one group, you might find specific interesting features, and then on the second group, you might find even more specific interesting features. However, you will now have to think, how do you now group all of these features all together so that you can start having meaning? So it's very likely that you can have a whole lot of codes. It could be hundreds, could be more than that. So it depends on how your data is actually showing or guiding you as you do this process. And then the third phase will be searching for themes. And this is the process where now you collate all the codes into potential themes. And this is done by gathering all the relevant data under each. So like I've mentioned that previously, during this phase, you will get to group, all these different codes that you think that, the talking about the same features or referring to the same issues. You group them and you now start developing what we call a mind map. So a mind map will actually assist you into asking, the questions such as, what is the broader pattern and what does it represent? And here you will get to be able to, to differentiate the themes based on these broad patterns to sub-themes. So remember, it's very important that you understand that a broader theme would actually capture something at a much more higher level. For example, if we want to talk about, barriers to eating healthy food, there could be those barriers that we identify at an individual level. There could be barriers that are identified due to household issues, could be societal, and so many other factors could play that role. So that's the part where you're going to say, from having this broad theme, you can now specifically, have a theme that talks about individual driven barriers. And this is where you capture barriers that are mainly driven by the individual themselves and not necessarily stemming or are not necessarily driven by other external factors such as family or community and so forth. So this process enables you to be able to do those kind of activities where you collect all these different codes into potential themes. And then the fourth phase will now be you reviewing your themes. And this part enables you to refine and test themes against the coded data and the full data set. So remember, it's very important that you always continue to check, what is happening with your data. Is it still following the very same process where you started, with your coding? Are you still seeing, this interpretation that you're coming up, or the the themes that are emerging from your data, are they still showing you what you were, getting from all these interesting features that you grouped? And are all these features still being represented within these themes that you have now generated? And this part would, lead you, or would require you to have, specific activities that you do. And that is, number one, checking if the themes, cohere internally. And this is very important because there needs to be that coherence amongst your themes in order for you to be able to make meaning. And if you see that one theme is definitely not talking to, for example, if we want to talk about emotional barriers, and something here is definitely not talking about the patient's, emotion or participants' emotion, but focusing rather on, external factors such as, lack of accessibility to healthy food. That is something different. And therefore, you should, be analyzing that or having that under a different theme. So looking or checking out for, how these themes are coherent is very important. And the second level would be to ensure that the themes reflect the whole data set. And like I've mentioned that, you don't want to miss out any of those interesting issues that you coded as you initially started your process of data analysis. So it's very important to be looking back to your data set and see, which aspect of your data set is not fully covered by the themes that you have. And this process, you get to, to split, merge, or discard, if needed, some of these codes or some of the themes. The process of combining, specific themes or sub-themes so that it can have much more meaning, or they will be easier to now actually interpret or relate the true meaning of the data as you would like it to answer a specific question. And then the fifth phase is now talking about or looking into defining and naming your themes. So now that you've had a review of all your themes, you now start defining and naming them. And this part, this is where you write detailed definition of what does this theme mean. So remember, you name the theme so that it can actually give the reader a sort of an understanding of exactly what the theme is referring to or what does it mean. And you also want the reader to understand how does it relate to the others. And here you get to create, what we call a thematic map. And you need to ensure that your names are analytic. You're not just naming your themes, based on, some names that you think about. The themes have to have an analytical meaning. We should be able to understand, barriers to healthy eating has a specific meaning within the data, or with the data that we'll be reading or that we'll be seeing as you're reporting your findings. And that is very important. So you need to ensure that your names are analytic and not just descriptive. For example, navigating vulnerability versus patients feel scared. So it's very important that you're not just describing in a very simple way. So it needs to connect to a specific or a broader issue that you would want, the reader or whoever that you'll be, capturing their views. We can now get the broader view. Like I've mentioned, that the themes capture what we call a broader view or broader point. And this would be informed by the multiple, data points or data codes that you would have, collated together as you started from your data analysis. So it's very important that this naming or defining of themes is very analytic. So in this case, navigating vulnerability has that interpretative point, because now one will start to ask, okay, so who was vulnerable? How were they vulnerable? And, what led them to be vulnerable? So those are the kind of questions one would want to understand when they see this kind of theme. And when you look into your reporting, you would want to see this sort of information coming out, and it would lead the reader to understand exactly what this theme means. And then the final phase will now be producing the report. And this is now where you weave the themes into a much more compelling narrative. And this would be supported by the excerpts from the actual data transcripts that you were reading. And this process will, involve you, or will need you to use quotes as evidence, and this would lead you or enable you to link back to the research question and literature of your, the research question of your study, and the literature that you read that informed the research question that you came up with. And this is the part where you get to balance the description and interpretation. Remember, it's very important that you do not think the description part of your data is the same as discussing your findings, something which you will have to do in the discussion session. So here you are focusing more on interpreting what does the data say, not necessarily discussing what the findings mean and how do they compare to the literature that we already know, and what sort of gap this data is answering. So you need to be very careful. Hence the issue of balancing, the description and the interpretation. So those are the 6 phases of, thematic analysis. And I've also added an example to help you understand exactly how this phases are integrated, or how you would actually go on about, doing these different activities, or applying these different phases within your own analysis. And using the same except from our previous example in grounded theory, you would now start with your first phase, where you get to read your transcripts, and you note, the emotional tone and power dynamics from the excerpt that you have read. So remember, our excerpt reads as follows: patients often clam up when I ask about their habits. it's like they're scared I'll judge them. Last week, one guy just said, "Doctor, it's hard to admit I'm not perfect," and shut down. So you can see this kind of except you can actually imagine the kind of conversation that this doctor and the patient were talking about. For example, it could be a question around whether they are practicing having safe sex. That's a challenging topic that one would actually not feel very compelled to actually disclose how they are practicing safe sex. Hence, you would see them telling the doctor that it's hard to admit I'm not perfect, and then that just shut down afterwards. So the first phase will include you reading the transcript to actually note the emotional tone and power dynamics with this conversation that this doctor is having. And then the second phase, which is now moving into the coding part, and this is where you start coding the excerpt, and you identify those very unique features about the conversation with this patient. For example, the patient silence, the fear of judgment, and admission of imperfection, and the conversation breakdown. So this means that you will now start having different codes trying to explain exactly the emotional and power dynamic that was taking place when this conversation was taking place with this patient and doctor. And then you move now into the third phase, which is now, the potential themes that you need to, or the potential themes that you can come up with from the excerpt. And this is the part where you now start grouping all of this. And remember, these codes are all talking about how, the patient is feeling, about actually disclosing their habit to the doctor. So you can now have a theme that can be possibly named or titled emotional barriers to disclosure. So already you have that analytical or that type of analytical meaning behind this theme, because now one will start thinking, okay, so this theme is focusing on how this patient was feeling, and this has led to them not being able to disclose their specific medical condition or habit and whatsoever. So this gives you already some meaning behind the theme. And the fourth phase, which now focuses on reviewing your theme, and this is where now you start comparing across your data set, how your data is actually being represented within this theme. And this is where you get to refine your theme to ensure that it captures the prevalence. How many times was this occurring when you interviewed your participants? Are multiple participants mentioning the very same issue? Or is it just only one participant or one patient talking about this issue? And this will get you to now understand, how to refine this theme. And then from there, you move into the fifth phase, which is now defining your theme. And like in the previous slide where I've mentioned that you would now understand that you move a step further into now being much more analytical. Now you want to capture the meaning, and this meaning will have to capture the broader point or the broader view of what the data is. And hence, we ended up, or you will end up having to name or define your theme as vulnerability in self-disclosure. So the patient, when they were having this conversation or discussion with the doctor, they felt very vulnerable about disclosing their habits. And in this case, we assumed that they are disclosing their habit in practicing safe sex. So because they felt that vulnerability, they were unable to fully disclose, how they have been engaging in sexual encounters. Whether it's safe or not, we would not know. And this has led to a shutdown in communication. So this theme would be able to capture this broader viewpoint, and it allows us to have that analytical view of what the data is saying. So here, the patient withholding that information to avoid the perceived judgment, the viewing honesty as, an admission to, or admitting it as a flaw, which will lead to the medical encounter not fully been conducted, or not fully been thorough for the doctor to actually understand how this patient has been living or behaving. So this would lead to that breakdown into an intervention. So therefore, we understand that because of this breakdown, the patient was not able to receive the kind of care that they deserved or needed or required at that point, because the conversation was shut down or it was broken down. And that's what it means to be able to capture, or define your theme in a way that captures the broader view or broader meaning of your data. And then the final phase, which is now the reporting accept. And it would go on to say, participants described a pervasive vulnerability in self-disclosure. And this is exemplified by it's hard to admit I'm not perfect. And that's from directly a quote from the patient themselves. You are now connecting your analytical point or your analysis on what the data means, and you support or back it up with the actual data. This is the part where we talk about linking the theme and the data, from the, patient. And this highlights how fear stifles open dialogue. So from this, you are able now to understand exactly how the theme and the data from the transcripts link up to actually generate the meaning of what this phenomena is about, or what is meant by the accept that you initially had. I hope that breaks it down, or this example breaks it down for you clearly, what, how to actually apply those 6 phases of thematic analysis into your qualitative data analysis. And now I would like us to move on. And I want to touch on this part that is very important for you to understand. And this is touching on the inductive and deductive nature of conducting thematic analysis. So maybe just to highlight this, that with grounded theory, when you do the analysis, it is much more inductive. And by inductive, this tells you that, the analysis, follows what we call a bottom-up approach. And this tells you that it's more data-driven and exploratory. So you analyze your data based on what the data is saying. And here, this is where researchers immerse themselves into the data without necessarily having a preconceived notion. So you do not have any specific idea or judgment, where you allow your codes and themes to emerge organically from the content. So this tells you that you're reading, coding, generating initial themes, defining themes is going to be guided by the actual data, and you not necessarily having a specific theory behind or a specific hypothesis behind. Whereas, deductive thematic analysis follows a top-down approach, and this is more theory-driven. And here, you as a researcher start with a specific theory or a hypothesis, and you use it to guide the entire analysis. here you get to apply a predetermined coding framework to the data to see if it aligns with the existing concepts. So these type of analyses are very important to understand and to know exactly when you plan your or when you design your study, to know exactly how you are going to analyze, which approach or which methodology are you going to apply. Some would use inductive, some will use deductive as standalone, but others would tell you that they've been able to apply both deductive and inductive thematic analysis. So it's very important for you to understand these concepts for your analysis. And I've tried to actually, have a comparison of how thematic analysis and grounded theory, look like what makes it different, what makes it unique, because I'm sure you could hear from my presentation that there are quite some similarities. For example, they're both, they both allow, inductive analysis, and the both focused on understanding specific phenomena. However, there are distinctive differences with both of them. And the first point will start with the goal for each. And we see that with grounded theory. I've mentioned that the main goal is to generate a specific theory or develop a specific theory. And this is going to be achieved by categorizing and processing, your data set into having this developed theory that you would like to come out of what your data is actually saying or capturing. And thematic analysis, like I've mentioned, is about pattern identification so that you are able to describe or interpret specific issues or specific experiences that are taking place. So that is one distinction that I can mention. And the second part would be the structuring of these two methodologies. And one, your grounded theory is much more sequential. So it follows, a sequence for you to be able to analyze your data. Like I've mentioned, that you start with open coding, you move into actual, and then selective. However, with thematic analysis, it is much more flexible. So that means that you are now able to look into the data and you are able to now apply your mind from a point of not necessarily being informed of anything specific. You would want to look at what the data is saying. So that flexibility actually leads you into uncovering much more richer detail into understanding or explaining specific experiences or feelings about specific context or specific situations. So that is very an important element for you to understand. So this will tell you exactly how you can be able to pick which methodology would suit the kind of research question that you would be having, considering the kind of analysis and what you would like to actually convey when you do your analysis. And then the other part is the coding process. So like I've mentioned, that your grounded theory sort of like fragments your data. So here it says that it fractures and then reconnects. So you break down all these different codes or different, data points or data sets. And then from there, you link them back up. Whereas with thematic analysis, you have codes, and these codes will lead onto themes. And you do that by collating all these different codes. And your output is also another distinction that you would need to understand, that, with grounded theory, you are more focused on the core category. And this would be done in sort of a theoretical model. Whereas with thematic analysis, you get to do what we call a thematic math. And this is in a much more or the form here is much more narrative. Like I've mentioned, this is focused more on describing or interpreting the meaning and experiences of people. And then, grounded theory is best for an in-depth process explanation. Like I've mentioned, theorizing would actually lead into much more deeper, much more rigor into actually developing that theory. And the thematic analysis is much more useful for capturing the broader insights, and it's very useful in applied questions. So like I've mentioned earlier, if you want to be able to capture the broader meaning or broader explanation from the data set, you would apply this kind of analysis so that it's well represented. And that's the comparison between grounded theory and thematic analysis coding. I hope that is clear, and I hope I was able to explain it in simpler terms for you to actually understand the distinction between the two so that you do not necessarily confuse them when applying them. And then there's an important part or an important aspect with doing qualitative data analysis, and that is the process of ensuring rigor and trustworthiness. So remember, with qualitative data analysis, you see that there's so many steps that you have to take, until you actually start reporting your data. And this is very important for you to follow that system, those systematic steps for ensuring this rigor that we're talking about, and obviously ensuring that your data is trustworthy. So according to Rigour and Lincoln, they give us these 4 key criteria that would see that our data analysis is both rigorous and trustworthy. And the first part would be, or the first criteria would be credibility. And the question that you need to ask yourself is that, are your findings believable? Are your findings actually capturing the true meaning of the participants' experiences, or what was actually occurring when you interviewed these participants? And this could be achieved through triangulation or member checking. So this is a part where you sometimes go back, interview your participants to actually understand, what they meant by specific things, to see if any other new insights would still come out. And this is very important because this talks to your credibility of your findings. And then this second criteria is the aspect of dependability. So, would we find similar results, or would similar results be obtained if the study were repeated? So you do this by maintaining an audit trail. So an audit trail is a process of documenting each and every step of your data analysis, from actually starting from your data collection, how your data was collected, who was involved, what were their age, where were they from, what was the reason for including them into the data collection, and then the analysis part, how were the data transcription done, who did the coding? Was it you only, or the coding or the data? The data analysis was done by multiple coders and so forth. So all those steps are very important that you maintain or you write them down, and that is what we call an audit trail, so that another individual or another researcher, when they want to conduct the same study, they would be able to obtain the similar results, like it says here, dependability. And then the third criteria is conformability. And the question we ask here is, Are the findings shaped by participants and not researcher bias? So remember, it's very important to note and understand that as a researcher, obviously your experiences, your knowledge or educational background, your age and so many other factors could contribute into how you have your own personal views about a specific phenomena. For example, a researcher who is directly experienced the living with the or being diagnosed by COVID-19 virus would actually have their own viewpoint or own insight about how they actually felt or how they experienced living with the disease. So that on its own should be considered that it could actually lead you as a researcher to have this biasness because you already have some sort of awareness or some sort of experience that could influence how you actually interpret or report the findings. So it's very important that you are careful as a researcher to not have this biasness, and the results should be shaped by the views of the participants, solely by the views of the participants. And this would actually talk to the issue of confirmability. And the last criteria is transferability. And here the question is, can the results apply in similar contexts? And this is achieved through a thick description. So how you now describe the meaning or the data, the interpretation of the data will now tell us, does this or do these findings apply to a much more broader context, or they only for that specific population where you conducted the study, or in other similar contexts. For example, we know that COVID-19 was experienced globally. The data set that we actually reporting from, my context here in Bembe, applicable, or do they, mirror what would have happened in similar context, which could be, composite, like having the same composite as the Bembe district, which is known as being rural, not having access to, healthcare services, or having limitations with healthcare services, and so many other issues that would contribute to the individuals here not fully getting the attention they need to address COVID-19 related issues should they have needed. And that's what transferability refers to or talks about. And then the other aspect that I want us to talk about is the issue of reflexivity. And this is very important because this also tells us how trustworthy your findings are. So reflexivity talks to that issue that I've just talked about, that, you as a researcher, you need to have an ongoing awareness of how your position, values, and assumptions shape the research process. So you have to know or take note that you are not necessarily a neutral instrument. And this tells us that your background, identity, and experiences, will inevitably influence how you interpret the data. So remember, the whole point of analyzing and interpreting data is for us to capture the views of the participants themselves, and not necessarily how the researcher feels or how they've experienced, the same phenomena, or they've experienced the same issue that we are investigating. So, for instance, for me as a biokineticist and a public health researcher, I often reflect on how my professional identity, could affect how I interpret participants' views on issues relating to exercise and health, because I already have, the theoretical backing and understanding of how exercise actually contributes to the, health benefits of an individual. that information on its own can lead me into having, a very biased view or a biased interpretation of what the participants are actually saying or talking about. And that is not how one should do it. So having that awareness of your own, values and position would actually assist you into, ensuring that your data is trustworthy. And being truthful about that part would also assure us that indeed these findings are trustworthy. So we do this by keeping reflexive journals or memos, throughout your project, which helps maintain that self-awareness and transparency. It's very important that you do this. And this, like I've mentioned earlier, you detail each and every process or every step that you have undertaken for you to, or leading to the reporting of your findings. And then there's, various ways you can be able to interpret as we wrap up. Integrate your qualitative findings in mixed methods. And for, due to time, I would want to just, spark some interest for you to actually, do some further reading on exactly what is meant when you actually, choose this type of methods when you want to integrate qualitative findings. And the first part is, sequential. So you can do, you can integrate your findings in a sequential manner. And this part, this is where, you can be looking at both quantitative and qualitative. And this would mean that one phase informs the other. And in most cases, you would find that most researchers will start with the qualitative data collection for it to inform how the quantitative data collection would be. And that's what we mean by the sequential. So one phase starts and with a goal that this first phase is going to inform the next phase. And that is quite useful as well. And then you have what we call concurrent. And this is where, both data collection are done. So you have your qualitative and your quantitative data collection is done simultaneously, and they are analyzed together. Here, the whole point, obviously, is to understand the meaning while utilizing both methodology. And then you have what we call an embedded methodology, where you now use qualitative methods to actually support or contextualize another. And in this case, it would be your quantitative data. So, now we have identified patterns of, sedentary behavior. Now we have identified patterns of unhealthy eating. Now we have identified patterns of physical activity. And now we can utilize the qualitative data to support what, these patterns mean and how we are actually seeing them. For example, if we, conduct a survey on physical activity levels, we can later use interviews to explain why certain groups are less active. And that's the integration that I'm talking about, and the different ways you can actually apply this integration of qualitative findings in mixed methodology. So we cannot, just have data without actually wanting to translate it into actual, meaningful, or contributes to policy and practice. Remember, the whole point of analyzing data is so that we can make something out of it. It should be able to improve or fill specific gaps, and we should be able to now utilize this into developing the theories or policies that we have in place. So once you have your themes and insights, how do we now translate all of them into, actionable steps, or what do we do with them? So there are various things that we can do, and your analysis can contribute into writing policy briefs, and you can do this by summarizing the key findings. And the key findings obviously will highlight those main aspects that you see will represent broader insights of what transpired during your data collection and the views that the participants were sharing with you. So this is very important if you want to give like a quick summary of things that would need to be taken into consideration, particularly on a policy level, so that the policies are updated and specific strategies are tailored to address those kind of issues. And this also can be done by hosting stakeholder workshops to discuss results. And these are very important because, at the end of the day, when you have information that has to be translated into actions, the stakeholders should be in a position to understand what your findings were and what do they mean for them to be able to take the necessary action. For example, if your findings show that majority of the participants that you engaged felt that they were unable to engage in physical activity due to that the environment where they're leading, there's a high crime rate, and this leads them to be unsafe. Such kind of information would be useful to actually relate back to the stakeholders to discuss the meaning of these results and how it contributes to a bigger or wider issue. And from there, you can now, start sparking, conversations around possible strategies that could be useful into, addressing this challenge. Also, this is very useful into developing infographics or community reports for much more broader impacts, similar to, stakeholder workshops. The issue here is to engage the community, have much more awareness around the findings, so that people could actually know, what is the meaning behind your data, and for them to be able to now understand the kind of actions they would need to take in order to address what you found from your data. So always bear in mind that qualitative research, brings human voices into policy discussions and making data relatable and actionable. And this is very important because from here, you know that because the data captures the views from the participants directly, it means that the strategies that will be developed will actually be much more relatable, as they will be informed by the views of the stakeholders or participants rather, so that they know exactly what would work for them and how that could work for them. So this is very important to conduct and analyze in a very informative and in-depth, so that all these voices are captured and fairly represented. However, there are some common, pitfalls that, are very likely to occur, which you should be very much wary about, or very knowledgeable, or take into consideration. And some of these common pitfalls that are mentioned, although there are many, number one is lacking a clear analytical framework. So it's very important that when you analyze your qualitative data, you're not just necessarily reading and cutting and pasting what's in the data. You must have that analytical component into your data analysis, and having that framework would actually allow you to capture the rigor and you interpret the true meaning of the data exactly how the participants were saying. So lacking that would actually lead you to not ensuring that rigor and trustworthiness that we talked about. And there's also that over-reliance on codes without necessarily interpreting. So remember, because we have textual data, it's very likely that you as the researcher is sort of like, relies too much on the codes. Remember, the codes are there to support your interpretation as the researcher. We need to now understand, what does it mean? What is the story from the data? And you say your story, you describe the experience, and then you back it up with evidence from the codes. So don't just think that simply having the codes alone is enough for you to say that you have now interpreted, or you have reported enough on what the data, or you've captured enough what the data is saying. So that is very important to do. And there also another common pitfall is neglecting reflexivity, which I just mentioned earlier. I won't waste much more time, and I would just like to mention that it's very important to keep an audit trail, like I've mentioned, that, detailing all the steps of your data analysis. The moment you start, it's very important that you have that reflexive journal and everything is well noted down, because you need to report on it as you're reporting back. And you can utilize or familiarize yourself with the qualitative software such as NVivo, Atlas TI. There's also Max QDA. This is very useful for managing. Remember, we mentioned that the textual data is very complex and it's high volumes of data. So managing this is not so easy to do it manually. However, you can be able to do this, using your Excel documents if you don't have access to your NVivo, Atlas TI, or Max QDA. And it's also very important that you maintain peer debriefing and intercoder checks for credibility. And this is a part where you involve other researchers to engage them on your coding process, your analysis process, so that your themes are not necessarily generated from a point of biasness, and mainly because of your own personal viewpoints and experiences. And this is very important, so that we can talk about that issue of reflexivity and trustworthiness, and also Rigour. And these pitfalls and practical tips will help you into maintaining these standards for very good quality reporting of your qualitative findings. And these are some of the readings that actually I found to be very useful into understanding qualitative data analysis, that I think you could do some further reading on, and this would actually help you to understand in much more detail what I was just talking about today. And like I've mentioned, I've only mainly covered part of the basics that would have you help you have a grounding, or have an idea of how to actually do grounded theory coding and analysis, thematic coding and analysis. And this literature would actually take it a step further. So feel free to look at this. There's also other literature out there that is available that could be useful for you. This brings the end of our session for today.